Hi guys, it's Dr. Megan. I wanted to take a moment to talk with you about a topic that we somewhat mentioned in the last video that we did when we were talking about the stomach. I mentioned acid reflux, and I thought, maybe we need to go just a little bit more into an understanding of what acid reflux is. So I'm going to give you kind of a nitty gritty. And hey, just so that we're clear here, this is mostly for educational purposes. This is not to diagnose you or give you any treatment options. It's more just to say, okay, this is how this is explained. Okay. So let me share that screen with you. So here we go. I'm going to pull up the slide that we were working with the last time. And the reason why is because I think it really is a pretty decent show there. I like that picture of the stomach. Okay, so remember how we talked about with the stomach, it should be really acidic. And ideally, that is great. I mean, like super great, because if you have an acidic stomach, that means you're breaking down that food. The problem comes in whenever the stomach contents start to go up into the esophagus. Okay, so we had mentioned with reflux, that's essentially what that is, where the contents of the stomach start to push up into the esophagus. And if that continues to happen, we can start to see erosion of the esophageal lining. So the esophagus gets really beat up in this process. That's known as Gerd, so gastroesophageal reflux disease. And essentially, what happens is that those contents just keep coming up and coming up, and they cause all sorts of issues. But I think that sometimes when we're working with patients, sometimes your symptoms of acid reflux are like, you see it. It's real, it's true, it's there, no doubt. But then other times you don't really realize that's what you have going on. And I'll see this a lot, especially in my practice, because I work with a lot of women who have hormonal imbalances and things like that. And they'll also have a lot of times symptoms of like anxiousness or things of that nature. And so I wanted to make sure that we were, kind of clear with some of the main type of symptoms that you will see from, reflux, and then some of the ones that you don't quite understand that that's what's going on. Okay. So, main symptom wise, you're going to feel like you can't eat the spicy foods, the citrus type foods, so you're like, man, I got to avoid tomatoes. I got to avoid anything Mexican. I got to avoid all this stuff because then it'll just get, I'll feel a burning sensation into the chest or into the stomach. You'll also notice that whenever you lie down, like in that horizontal position, of like, oh, you can feel it you can feel something kind of coming up. That's a reflex. That's a reflex type symptom. Those are probably the top ones. You might experiencing a lot of bloating, and just in general pains. So one of the things that I think is really interesting though, and that a lot of people don't realize is that, constant clearing of your throat could be a sign that you have reflux. It's like a, that, not like full on coughing, although sometimes you'll see coughing. A lot of times it'll just be like a kind of clearing of the throat because you don't really realize the only symptom that you're really having is that you feel like something's kind of causing pressure and you're just trying to clear it out. So a lot of times I'll have patients say, man, my sinuses or whatever, because I constantly feel like I have to clear my throat. And then I'm like, looking at them going, well, that's weird because that's not really showing up for you. And then we'll start doing some investigation. I'm like, I think you have some reflux. And we might call that like a silent reflux, or, not those active symptoms where you notice like the worst things, but you might notice that. I want to point out this chest pain aspect because a lot of times people can be thinking they're having, some type of cardiac event, or they think that, they have just like a lot of times with women, they're just like, my anxiety is just, it's so awful. It's just, I can't even like the pressure on my chest, the tension in there. Well, I think it's really interesting. I want to point this out. The first portion of the stomach, there were different portions of the stomach, and I didn't go into, naming all the different cells and all the different portions of the stomach because that's not what you're here for. You're here to just kind of get a general understanding. That first portion of the stomach, where did my marker go? This one right up here. That's referred to as the cardiac portion of the stomach because it can give cardiac like symptoms. It can make you feel like you're having some type of cardiac thing going on, and you'll freak out and you'll go to the doc and you're like, oh my gosh, what's going on? They're like, heart's checking out good, EKG comes back good, things like that, are all okay. And it's like, well, what's going on with me then? And you might be told you have anxiety, or you might be told that you have reflux. So I wanted to kind of point that out, in case you guys, weren't aware of it. Maybe some of you have longstanding reflux and you're like, I don't know why I have such bad, like anxiousness. And well, the reason is because it directly affects, it creates that pressure right down here and it goes into the chest and it can feel like a tight pressure. You can have sensitivity and things of that nature. This is by no means, though, guys, if you feel like at all you are having any type of heart type related symptoms, you need to make sure that you get those checked out, because just because it could be the stomach, that doesn't mean that it is. So you absolutely need to be doing your due diligence and make sure that if you are having any of those symptoms, that you go to that, respected authority figure, whoever it is, cardiologist, whomever, and get that checkup to know that that's all okay. Now, I wanted to point something out for you too, because this is one that's less known. There's a space, I don't know if I can really do it so much on myself. There's a space like right here, just right underneath, like right where your lower rib cage is, right there. You can feel like the bones as they go kind of down like this. And you guys probably, some of you probably know, because I do this check a lot on you guys. If you touch like right there on those lower ribs and you find that it's kind of tender, and what you're going to be looking for is on the left side, is it if it's tender on that left side there, then that is a sign that we might be having something going on with the stomach. It's just a common reflex point that we'll see with reflux. So if we're starting to notice some tenderness in there, well, then there are different ways to go about that. So I'm not going to get all into the treatment options for it. There are natural options, there are medications, there's just so much that you can get into. But I wanted to give you guys a couple of just a little bit of an understanding about reflux. What does it mean? What kind of things might you be exhibiting? And then if you are having questions about, okay, well, what can I do now that I know that? Well, then let's talk in your office visit about certain options that you have, because it's really going to vary person to person, because not everybody's the same. Some people have, symptoms related to less acid than they should. Some people have too many acids. Some people have their stomach is pushed up. They have a hiatal hernia. All of those things are going to change, treatment options for you. But I just wanted to give you a little bit of information and let you know, like, okay, this is what that means. If you guys weren't aware of it, this is what it means. And then we can discuss what to do in any office visit. Okay. So I hope that was helpful. I hope you guys learned a little bit about reflux. And maybe some of you guys are wondering if you have those things. Definitely talk with me at your next visit. Put any comments below and I'll be happy to kind of help answer them. And then pay attention, because we will be having more information on how to support a healthy digestive process just by eating better foods and making good lifestyle choices. Okay. All right. Talk with you guys next time.